would like to introduce our session, Navigating the NIH Grants Policy Statement, led by Rebecca Claycamp. Rebecca Claycamp retired in 2020 as the Chief Grants Management Officer for the National Institute of Mental Health, where she was responsible for the oversight of all fiscal and administrative activities for the Institute's $1.6 billion portfolio of grants and cooperative agreements. Prior to coming to the National Institutes of Health in 2001, she spent 19 years as a research administrator at the University of Kansas, the University of Iowa, and the University of Pittsburgh. She continues to consult and work on varied research administration projects. Rebecca has received numerous awards and is recognized as an accomplished educator on topics across the research administration spectrum from both the sponsor and recipient perspectives. She was an inaugural member of the SRAI Distinguished Faculty and continues to actively participate in the education mission of SRAI. Welcome, Rebecca.
Control of my slides.
Looks good.
All right. Now, if it will just let me behave. Okay. Good morning. At the end of this class today, I'm going to quickly go through some caveats to get us through the class today. I'm hoping that you'll be able to understand the NIH Grants Policy Statement and how it relates to the federal laws and regulations. I hope you will understand how the Grants Policy Statement is organized. I want you to know the 4 words that change what a sentence in the Grants Policy Statement means, and you should know those 4 words so that you know exactly what you're supposed to do when you read a piece of grants policy. I want you to become familiar with the most frequently referenced sections, and I want you to have, going to have seen some of the citations for the most commonly asked questions that we get at NIH, and that hopefully you're getting as research administrators in the field. I'm going to put a disclaimer on today's class. I'm not going to discuss the details of the revised 2 CFR 200, the uniform guidance that was issued in August of 2020, and I'm not going to preview the fiscal year 2021 version of the NIH Grants Policy Statement, which is expected out any day now. The principles for using the Grants Policy Statement presented today will align with the new Grants Policy Statement, and the vast majority of policies will be identical to what I presented today. Which reminds me, if you are so inclined and you have a spare screen or you have a paper copy, you may want to open up a copy of the Grants Policy Statement right now to follow along. For some people, that will be a better way to work. And you'll want to watch for the NIH guide notice for the NIH we talked about what provides the framework for the management of NIH grants. It is 2 CFR, Code of Federal Regulations, Part 200, also known as Uniform Guidance. And Uniform Guidance was either implemented as institutes, various agencies implemented the regulations. They chose to either implement it as is, or they came up with their own version of interpretation of the uniform guidance. For like the National Science Foundation has its own interpretation of uniform guidance. And for all of the agencies in HHS, Department of Health and Human Services, of which the NIH is a part, it is included in 45 CFR Part 75. Next slide, please. Oh, click it again. This is what's going to be hard, is these slides have got builds. Okay, next slide, please. All right, I want you to start clicking through these, just kind of count 5 seconds between, because basically the laws, and go ahead and start clicking, policy is established on laws, and laws take precedence over regulations. Regulations such as 2 CFR, 45 CFR, human subjects regulations, and they take precedence over agency guidelines as well as policies, and then the penultimate is the special terms and conditions, which you see in the notice of award or is outlined in a funding opportunity announcement. Next slide, please. So the NIH Grants Policy Statement is part of award term and conditions. Individual awards are based on the notice of award. They're next item. They're also based on the conditions, 45 CFR Part 75, any national policy requirements, federal award performance goals, and last but not least, they're also one more, the notice of award, all the terms of conditions that are in an award. Okay, next slide. The next slide, the application of the grants policy statement are, unless otherwise noted, a revision applies to all the grants and cooperative agreements from October 1st of the publication year for that budget period. If there are any intervening statutes or regulations or requirements that come out, they are published in the NIH Guide for Grants and Contracts. So the way to make sure you're on top of that is to subscribe to the NIH table of contents. You get a weekly email that gives you all of the new notices that come out, as well as all the new funding opportunities. Next slide, please. Hit it again. My number one tip for you is to be sure that you have an NIH grants policy statement, a copy of the document on your desktop to refer to. And whether you have a paper copy or a electronic copy, bookmark and highlight it so that you can use it. Here's the grants policy statement link. This is where you can find your current copy, but frankly, anytime you go in, if you Google on the words NIH GPS, it will take you to this site, and that way you can make sure you get not only the current copy of the grants policy statement, but any previous copies, because remember I said the grants policy statement was the one that was effective with the budget start date. So if you have an old grant that has a problem, it won't be the 2019 grants policy statement that you have to refer to. You have to refer to the grants policy statement that was in effect when the grant was awarded. Next slide, please. Okay, so I'm going to make a case for you. Hold on. Well, the conceptual, it's okay. A conceptual basis for how to use a grants policy statement. If I told you to jump off this building, would you? Next, please. You probably would think at me that I was crazy, but instead, next, please. If I told you that the bottom 4 floors were on fire, you might think about it differently. Next, please. You have the context that whether you're talking to a program officer or a PI or recipients, you don't talk as if you're the source of the requirements. The grants policy statement is. And when you show people in the document, well, they say we have to do this. They say we have to much more level. Next slide. I'm here.
All right.
Okay. All of a sudden I went off and went on. Okay. So hit this a few more times. So part 4, I'm gonna just let it go. That's fine. That's the organization, and we're going to touch on these. Next slide, please. So my second tip is that there isn't an index, but there is this table of contents, and this is what you're going to want to use. Next slide, please. All right, and here it follows, and again, sections the numbering is never changed. Even when a regulation or policy is added, the numbering remains the same for year to year. If a policy is eliminated, literally the section is eliminated. Section 4 is where you can see those policies that have fallen off. Next slide, please. Okay, I'm going to give you the 4 words that you need to know to be able to navigate the grants policy statement. Click it once, please. The first is must. In every instance, click it again, please. Must means always. The new application must be submitted on the scheduled due dates for new applications. There's no wiggle room on that one. Click it again, please. The next word is should, which is recommended practice. You don't have to do it, but it is NIH's opinion that this gets you the best result. Click it again, please. Therefore, prospective applicants should check. The next should check the announcement to determine IC participation. You don't have to, but if you want to make sure that an IC is participating, you should. And the last two words, click it again, please, are generally and typically. Exceptions do occur. Click it again, please. So you'll see that cooperative agreements generally do not result from investigator initiations. That means most of the time, but not always. Next slide, please. Okay, there are 11 useful tables. They're referred to in the document as exhibits. You will probably want a number of these bookmarked to make your way through the document. My favorite one is Exhibit 5, selected items of cost, that's located in section 7.9.1, which tells you whether certain items of cost are allowable or unallowable. Next, please. The first section has two parts in a glossary, next, both 1.1 with abbreviations and 1.2 definition of terms. These also are not just NIH specific, they coincide with the entire document, with the entire uniform guidance. So looking in this helps you with all of your federal government sorts of grant definitions. Next slide, please. You have section 2 that talks about the NIH grant making organization. Hit it again, please. The most important thing in here is section 2.3.7, which are policies that are affecting application. Next slide, please. And here are the general sections that you can, again, read through these. What I'm going to do is slip you through a couple of actual grants policy case studies. Next one, please. So if you can do poll number 1. And basically what I'm asking is prior approval needed to submit an application requesting $500,000 or more a year? Hit it again, the slide, please. And the choices are, yes, it always, no, it's a requirement, go and hit C2. It depends. What's the right answer? And I can see the poll is coming through.
Rebecca, let me know when you'd like me to stop the poll.
We'll give people just a little bit more. Okay, so let's go ahead and stop the poll and hit the slide, please. And it was very close, but the answer is it depends. And you're going to say, what is this? Next slide, please. The Grants Policy Statement, section 2.3.72 says any applicant requesting $500,000 or more required to contact the ICPO in writing or per telephone. You'd say, well, wait a minute, but this policy does not apply to applications submitted in response to RFAs or other announcements that include specific budgetary limits. So if you're responding to an RFA, a request for announcement, and there are specific budgetary limits already included, you do not need prior approval. So the correct answer was C, it depends. Next slide, please. So for many, many years, go back one, the picture. For many years, I've been saying what I do in research administration is an adult incontinence product. It says it depends. Now, if we go to the next slide, I'm going to tell you how to get through it depends as an answer. Would you hit all the answers on this slide? There's like 5 or 6. To know your, there you go, stop. Know your institution's rules. Ask clarifying questions. Be sure you've read section 4 of the Notice of Award. Sometimes a Notice of Award will have special things that supersede what's in the grants policy statement. When you're talking to a researcher, especially in this environment, when you can't go down the hall and talk to them, get it in writing. Many times when I even have had a call from a university person, they ask me one question. When I get it in writing, I have more information to work with and I give a better answer. And always direct people to go to their grants and contracts office so that they can function well and get the best answer possible. Next slide, please. Oh, and the added thing is don't be afraid to pick up the phone and call NIH. Never be afraid. So here's our second question. Can we have the second poll question? A foreign postdoc wants to know if they need to be a US citizen to be a PI on a grant. Generally, yes. Generally, no. And it depends. I think we've got such a preponderance of an answer. Let's end the poll. I've generally gotten the answer that the answer is C, it depends. Next slide, please. Are you right? Yes, it depends. No for most programs, research grant programs, but yes for certain programs. Yes for certain programs includes some of the K career award programs where citizenship is required. Next slide, please. So again, here in section 2.544, it tells you that generally they're not required to hold any particular education degree and not required to be US citizens. So again, the example under career awards and our Kirstein awards, there the citizenship may be required. Next slide, please. And somebody's just asked, are most NIH questions answered? It depends. Ha, 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 just wait. So back, but it's not that straightforward. Who does an institution permit to be a PI? So in general, yes, that postdoc that calls and says, can I be a PI on an R01 grant? Yes, they meet the terms I showed in that previous slide, but let's go to the next slide. The PDPI is an individual designated by the applicant organization to have an appropriate level of authority. So an institution, a person themselves could be qualified to be a PI, but the institution chooses not to let those people become PIs. So most universities, for example, do not allow postdocs to be PIs. Why not? Well, because of the commitment, the institutional commitment that would have to be made for that person to be a PI. So they frequently limit it to faculty and faculty equivalent positions. Next slide, please. Is the funding opportunity announcement has a direct cost limit? Does that limit include, let's look at the next polling on that while we're at it. Is that limit include the F&A of any included consortium? And the answer is so a number of you people looked at that it depends that I gave you, and you think that that's the answer to everything, and it's not. And this is why it's so important to look at the specifics that are outlined in the grants policy statement. Would you go to the next slide, please? I'm getting, let's stop the poll. Only a slight by the direct cost. A lot of people saying it's, and the answer is no, consortium F&A is never part of any direct cost limit in an FOA. Now, could you go to the next slide and I'll show you the policy that's identified in 2.3.7. There it is, 2371. Applicants should not consider these costs when determining if a budget exceeds a direct cost limit. Now, if in a few very, very rare cases, in very, very large, complex grant programs, there may be a total cost limit, but that is a very rare event. So again, consortium F&A is not included. Okay, next slide, please. Okay, next slide, please. Let's do another one. Is there a limit on graduate student compensation or wages? So there's a close battle between A and B. I'm going to give it just a little bit longer. Okay, let's go to the answer and polling, and the answer is there's actually only a limit on what NIH will award. The institution retains the ability, next slide please, to rebudget the maximum amount we will award, but you go down to that same policy and says that the institutions may continue to rebudget funds to charge more than the awarded amount, provided that OMB cost principles requiring reasonable compensation are observed. Okay, so I can tell you as an example, Columbia University routinely rebudgets to pay their graduate students more, the typical graduate student wage at Columbia University in New York City. Next slide, please. Okay, what is the time limit for submitting an A1 application? Can we start that last poll? And people are going to be surprised by this answer. Okay, let's end polling. People thought it was 18 months. That was by far the largest answer. We show what the answer is. It's actually 37 months, believe it or not. Now, next slide, and I'll show you the policy. 2.3.7.4 allows for one resubmission, a 37-month window. The initial submission of that new application is the starting point for the 37 months. Now, you might ask, how can that possibly work? For most science, 37 months would be inappropriate. The science would progress so that the original application would no longer be relevant. But that still is what policy allows for at this point. So the urgency to resubmit may not be so great for some research. Next slide, please. We're going to slip through the general chapters of 3 through 8. There is a standing joke at NIH is the only 3 chapters that you really need to refer to are 4, 7, and 8. And actually, you will spend a large portion of your time using these 3 chapters. Next, please. Next slide. So we've got sections 4.1 and 4.2. When you are have insomnia at night, do refer to these chapters. You will enjoy them immensely. They will put you to sleep, and but you will learn a lot of important requirements for managing your grants. Next slide, please. Here's all the section, well, not all, a portion of section 4.1. Next slide, please.
Hey, Rebecca, we have a question.
Oh, good.
Is there a considerable amount of A1s that are being submitted close to the expiration of that 37-month window?
All right, I didn't understand the question. Would you repeat it, please?
Sure. Are there a considerable amount of A1s that are being submitted close to the expiration of that 37-month?
No, they're not.
Okay, thank you.
Okay. So we've got a next one, a policy. This is built out of that policy. A PI, can we do the poll question, please? A PI is traveling to Brazil to collect human subjects data as proposed. The PI has found tickets to using a small, less costly foreign carrier. Is that allowed? Now the deal is, if I show this same question to a group of PIs, they will, unless they've been trained, will automatically say A. They believe that it saves the grant money, and that's what their major priority is. But as we've got the answer, people are overwhelmingly answering C. And the polling, please go to the next slide, because the answer is It depends, but in this case, probably no. Now, what this refers to is the Fly America Act. Next slide, please. Which is found in section 4.1.11, and you hit it like 4 more times so we get the little bits and pieces underneath it. There we go. And these are the exceptions. I don't keep these exceptions in my head either. When I have a unique case, I refer to the grants. And this is one of these wonderful cases where when you share this with the PI, you give them the reason that you've got to jump off the building. They may not like it, but this is what the regulations require. Next slide, please. Chapter 7, and we'll have the cost principles. Go ahead and make the slide, populate the slide. Here are all the sections that are available in that. Next slide, please. Section 7.2, next slide, please. Section 7.2 is wonderful. Back one. I'm going too fast. Here is this wonderful definition of the cost principles. And again, when you're working with a relatively new principal investigator and they don't understand why you consider certain costs allowable or not allowable, this piece right here helps tremendously, especially with regards to allocability, which so many people seem to have problems with. Next slide, please. So section 7.9.1, I mentioned exhibit 5 earlier. Here are all the selected items and cost, and it will help you immensely as you're trying to, again, work with researchers on certain items being allowable or unallowable. Next slide, please. All right, we have a situation here, and this has never happened to any of you. Can we have the polling, please? PI wants to provide pizza for the research groups. It's exclusively to discuss results of the grant and make plans for the next experiments in place for that particular grant. And again, this is one of these areas where if I can tell that I'm talking to a group of research administrators. Next slide, please, because you are saying no, as opposed to a PI would typically say yes. Well, we're doing the work of the grant exclusively. Isn't that allocable? And the answer is no. But again, what do you show to the PI to help them to understand? And next slide, please. Right here in that 7.9.1, when you do click it again, please, under meals, it says, however, recurring business meetings such as staff meetings should not be broadly considered as meeting for the primary purpose of disseminating technical information to justify those food costs. So this is the black and white that says no, pizza for the research group meeting is not allowable. Next slide, please. All right, click this several times. Section 8 has the various administrative requirements, both the items that are standard terms of award that are part of every grant, like cost-related prior approvals. Next slide, please. And as well, the prior approval requirements, the 17 different things that step through and have items that require prior approval. Go ahead to the next slide before you can proceed. Now, one might say, go ahead and click till we hit up number 17 or 16. 17. You notice I said 16 or 17. I don't keep all of these on the edge of my tongue either. And again, some of these, like rebudgeting of funds between construction and non-construction work, or I'm looking for my other favorite, sub-awards based on fixed amounts. Those you will not likely encounter as often on routinely on a grant. So you may not remember those, but things like change of scope, you should remember that in every instance. And look at this section and familiarize yourself with the kinds of things that are going to require prior approval. Next slide, please. All the monitoring things are in that section. Let's go ahead and go to the next slide and the next poll, please. So is prior approval required to provide 50% of the cost of a piece of equipment that was not in the original budget? And I have a close race between A and C. And I could speak to some of you. Let this go just a little bit more. Okay, I could speak to some of you and you could point me to a policy in your institution that says if we have a piece of equipment that is not in the original application, you have to have permission from the sponsor agency. And you probably could show me that policy. And that may be true. That is your institution's policy, but it's not NIH's requirement. So would you go to the next slide, please? From NIH's perspective, we only require cost-related prior approvals. We leave with the institution, and we do not require that the cost-related prior approvals change, a significant budget change requires prior approval unless the change requires a change of scope. Now, I do know some institutions to have conservative control of what's going on at their institution does require prior approval if it wasn't in the original application. And what will happen in those cases, and you'd say, well, can our institution do that? Your institution may have more restrictive policies and procedures than the NIH, but you can't have less restrictive. So it's not uncommon. We do see universities and hospitals that have that requirement that if it's not in the original application, it does require prior approval. And if you come and ask us if this piece of equipment you give approval, we'll check with the institution or check with our program officer to make sure it is not a change of scope. And if we agree that it's not a change of scope, then we will tell you that it's within, we won't give you approval. We don't give approval for something you already have authority to do, but we'll tell you that it does not, we don't consider it a change of scope and it's within your institution's own delegated authority. Now, an example, if you say, well, gee, wouldn't a piece of equipment always be a change of scope? Well, let's say a piece of equipment breaks, an essential piece of equipment, and needs to be replaced. That would not be considered a change of scope. Now, there may be other considerations that you need to make about how you're going to do the project if you divert a large number of funds. But in terms of an absolute policy requirement, it's not there. Okay, I hope that was helpful. Next slide, please. Okay. And this talks to you, what if they've sent the request? Next slide. That's what we're going to say as that's the sentences that we'll use. There's does not constitute change of scope. There's no need for NIH prior approval. Next slide, please. All right, a PI lists a co-investigator, and let's do the next poll, as a senior personnel on the application, including the BIOSKETCH for the awarded grant. Is prior approval required for the effort of this individual reduced by 25% or more? This person has been listed as key in the application by the institution. So this is a flat out tie between A and C. But the answer is, actually, it depends on the notice of award. Is the co-investigator named as key? Go to the next slide, please. And you'd say, well, what? The recipient is required to submit prior approval if there's a significant change, senior key personnel specifically named in the notice of award. For the vast majority of awards, that only means the PI. But you need to look at section 4. On some occasions, other key people, for example, on a P50 Center award, we will frequently name other individuals of the various sub-projects of the award. Now, where this is often confused about giving updates on other support of key personnel in the RPPR, when it comes time for the RPPR, you are required to give updates on other support of all the key personnel you list, the institution list, but that is different than the prior approval for the 25% reduction. Okay? Another important reason to read that notice of award. Next slide, please. And are we okay for time? I know we're right bumped up against, only got a couple more. A grant needs to add a consortium solely because one of the PIs has transferred to another institution. Is prior approval required? Okay, I'm seeing the predominance of C. It depends is the choice. And the answer is, it actually is, it depends, but not necessarily for the reason that you think. The thing that we're going to focus on, a consortium in itself does not indicate necessarily change of scope. If a co-investigator is moving from one institution to another and nothing else is changing about that institution, the consortium itself wouldn't necessarily, addition of a consortium wouldn't be defined as a change of scope. Now, again, your institution may choose, in every case when you add a consortium that wasn't in the original application, you may choose to ask for prior approval. But again, if you ask the NIH, we may tell you it's within your own authority. Now let's look though about the one exception. Next slide, please. If the consortium will be foreign, you will be providing the recipient the prior approval. We have to have prior approval for any added foreign consortium. But if the consortium is domestic, and assuming the request does not constitute a change of scope, there's no need for prior NIH approval. Okay. Next slide. Can a fellowship be charged pre-award costs to cover? Let's look at that last one. An institution has word from NIH that the fellowship will be awarded shortly. The fellow's current support is ending, leaving at least a one-map gap of funding. The institution can elect at its own risk to establish an early account to cover the institution. Oh, I'm glad I asked this question. Come on, people, don't be afraid. Okay, so overwhelmingly, people are saying C. Can we end the poll and show the answer? No. Stipends may not be charged to a fellowship award until the fellow has actually activated. What happened to pre-award cost? Gee. Okay, next slide. And the actual reference is here in 11.2.9. There are some rare occasions where some of the institutional allowance may be allowable, but stipends are not allowable. Now, why did I show you this slide on fellowships? You say, I never will work on fellowships. But what I want to show you by giving you this slide is that briefly, if you're working on one of the specialized things that are discussed, whether it be K awards, career awards, fellowships, training grants, revert to the special chapters in the grants policy statements, because these awards are slightly different and behave differently and sometimes have special requirements. Next slide. All right, there's the specialized chapters again, NRSAs, career awards, modular applications, conference grants, the whole list, each of these chapters. Next slide, please. Part 3 has that points of contact that can be useful, but actually the references online are generally more up to date. Next slide, please. So it depends. And I'm going to, again, how do we get through it depends. Next slide, please. Be sure you have enough necessary information. Ask questions if at all necessary. Next slide, please. And it seems like we have, the presentation has stopped. Okay. So are there any final questions? The end slides reemphasize about how to deal with it depends.
I do not see any additional questions yet. Rebecca, does that take care of your presentation, or is there anything?
I think it does. I think it does. And just those still on, if you do have questions, feel free to email me at claycamp.rd@gmail.com.
Okay, well, that concludes our session on navigating the NIH Grants Policy Statement. Thank you, Rebecca, for such.
Thank you very much.
It was a fun and interactive presentation. Thanks to everyone who participated. If you have any additional questions, please go ahead and email them to Rebecca. Just so you know, our next session with James Casey will begin at 1 p.m. That